Hello, I'm Dr. Max Gomez, and I am here at the 5th International Vatican Conference. And now I'm with Ellen Wright, Dr. Ellen Wright Clayton. Thank you, Dr. Clayton, for your time. Dr. Clayton, let's start out with, we all attend many of these different scientific conferences, and they tend to be rather narrowly focused. I know that you actually have a very broad focus in terms of your interest in research. What do you think is the value of bringing all of these different disparate people and disparate points of view into one conference?
Religion is a source of morality for many people, and it helps people understand how they're going to deal with advances in science, which are coming fast and furious. And until we have a conversation between religion and the sciences, I think we'll be talking past each other in a way that actually doesn't allow us to reach informed, acceptable decisions that will affect the entire population of the world. I think this is absolutely critical.
Dr. Clayton, you've said that as human beings, we are sort of wired to seek enhancement. What do you mean by that?
Well, the way we're going to have to do it is listen to people, first of all, and we're going to have to understand what their concerns are. Whether it's because they have had an experience of past discrimination, whether they doubt whether the science is right or not, whether they doubt that even COVID is a disease. In addition, we have a moral obligation to get vaccine to all parts of the world, and not just really wealthy people. It's absolutely essential that we do that for two reasons. One, because respect for other people requires us to deliver the benefit of this intervention to them. And two, on a more selfish level, we're not going to beat this thing until everybody has access to vaccine and we can eliminate it. We've done this in the past with polio, or almost with polio. We did it for sure with smallpox. We're about to do it with measles. I mean, this is a moral imperative to get rid of these diseases, which have killed millions of people over the years. We just have to do it. But in order to do it, we have to listen to what their concerns are and develop strategies that are going to speak to them and address their concerns.
Are there limits that we need to take into account when it comes to this sort of enhancement?
Absolutely. I mean, we need to think about the downstream consequences, and we need to think about the consequences within the medical system. Are the advances that we're talking about something that people are going to be able to understand, be able to use, act on? All of that is tremendously important. Are they going to have access to it? Given that, particularly in the United States, our healthcare system is so patchwork that some people have access to a lot and others have access to a little. So all of those consequences need to be thought about, and not to think, oh, I've got this new discovery, isn't this great? Because, the data don't equal policy, and data don't necessarily confer benefits. So we have to think about all those things. And I think we have to think about that both in the science that we do, so that we're thoughtful that what we do actually has the possibility of conferring benefit to patients and to other people. And then we have to think about how we're going to deploy it in a system that may or may not be particularly effective about doing it. So I think generating new knowledge is great, but in order for it to confer benefit, we have to deliver it in a way that people will accept it and can act on.